just kind of looking at the numbers there on that, if you look at the consolidated, if you look at total revenue of, total actual revenue of 23,922,000, and then you look at the discounts and allowances, 16,825,000, I mean, leaving us with a net revenue of 7 million based on 23 million of bill charges. It is a huge number. We were talking about it, you'll see it some in the audit presentation. Our bad debts are still a significant number for us. And we're talking about today trying to figure out, I mean, we're not really doing anything differently than we did last year. The bad debt continues to be a significant issue for us. If we do away with our bad debt, I mean, we'd all be well. But it's not us. I mean, that's an industry-wide problem, and particularly rural hospital problem is the bad debt.
Ray, wouldn't you say also that some of that has to do with more and more employers are going to plans that have greater deductibles, so patients are having to come out of pocket more than they ever have, and patients don't have the money. So if you were stuck with a $6,000 deductible,
It's a significant problem there, and that's one of the kind of the shortfalls that you hear about the insurances that patients are buying. Is that they're buying insurance, and they're buying the lowest cost insurance they can, and they don't really realize what the net result of that is. You can get a lower premium, but it's going to have a huge deductible on it. So you have only catastrophic coverage. And the problem is that many people only have so many dollars, say a couple $1,000 for health care. If they're spending that on a health care plan that has a big deductible whenever they come in for health care services, then they have zero money for health care. So it's a tough problem. And just being honest about it, in Texas, it hurts us because we haven't expanded Medicaid. We are politically on that, but from a hospital standpoint or healthcare standpoint, I mean, it sure would be nice if we had the expanded Medicaid, because we could just cover more patients with some coverage. Not that pay a whole lot, but it pays something, and that's hurt the industry of the failure to expand the Medicaid program.